Short-term chemoprophylaxis for malaria before traveling to an endemic area is as follows. Doxycycline daily for 6 weeks, chloroquine fortnightly for 6 months, mefloquine daily for 1 month, proguanil weekly for 3 weeks. When traveling to malaria endemic areas, short-term chemoprophylaxis can help in preventing the disease. Doxycycline taken daily is one of the recommended regimen for travelers. It should be started 1 to 2 days before travel. It should be taken daily during travel and continued for 4 weeks after leaving the endemic area. Apart from its efficacy against malaria, a significant advantage of doxycycline is that it also provides protection against bacterial diarrhea, a common problem for travelers. However, it's essential to be aware of its side effects and contraindications. So the answer is A. Doxycycline daily for 6 weeks.